If your squat doesn't look clean, your body tells a story. Every shift, lean, or collapse points to a specific imbalance. This guide breaks down a full overhead squat assessment so you can spot issues fast and fix them with purpose. Save it, use it, coach like you mean it. First, let's check the feet and if they turn out. If the feet turns out, that means your calves, the soleus and the lateral gastrocnemius, and your biceps femoris, the short head, and TFL are overactive. Your medial calf, hamstrings, and glutes underperform. This happens because your body looks for stability by externally rotating the feet. To fix it, you should stretch your calves and hamstrings, strengthen your glutes, and train single leg balance. If your feet flatten or collapse inward, this means that your peroneals, lateral calf, and TFL dominant. Your anterior tibialis and glute medius lag. Your arch collapses to absorb force instead of controlling it. To fix it, strengthen your anterior tibialis, train foot stability, and add single leg calf raises. Now let's check out the knees. If your knees move in, it's called a valgus. That means that your adductors and TFL overpower movement. Your glute medius and maximus and VMO fail to stabilize. Your body collapses inward to find balance. To fix it, you need some glute activation such as bridges or lateral walks, adductors and TFL stretching, and controlled squat patterns. If your knees move out, varus, it means that your piriformis, biceps femoris, and glute medius dominant. Your adductors underperform. This happens because of an overcorrection or tight posterior chain. To fix it, stretch the posterior hip, strengthen the inner thigh or the adductors, and add adduction-based squats. The lumbopelvic hip complex is commonly referred to as the LPHC. If we have an excessive forward lean, this means that calves, hip flexors, and abs overwork. Glutes and spinal erectors underperform. Limited ankle mobility or weak posterior chain can cause this. To fix it, stretch calves and hip flexors, strengthen glutes, and train upright squat mechanics. If your lower back arches, it's called an anterior tilt. It means that your hip flexors and lat dominant, and your core stabilizers and glutes fail to control pelvis. Your pelvis tips forward under the load. So to fix it, we're going to stretch hip flexors and lats, strengthen deep core, and practice a neutral spine. If your lower back rounds, you have a posterior tilt. It means hamstrings and abs are dominant. Glutes and spinal erectors underperform. You lose spinal integrity at depth. So to fix it, we're going to stretch our hamstrings, strengthen glutes and erectors, and improve squat depth control. Next, we'll check the upper body. If your arms fall forward, it means lats, pecs, and internal rotators are tight. Your mid-lower traps, your rhomboids, and your rotator cuffs are weak. You shouldn't stay stacked over your base. So, to fix it, we're going to stretch the lats and chest, strengthen upper back, and practice overhead positioning. If you have a forward head, that means your neck stabilizers are weakened, and your upper traps and SCM are tightened. This usually happens because your posterior compensation is under load. So to fix it, strengthen neck flexors, stretch upper traps, and keep a neutral head alignment. Another issue could be excessive shoulder elevation. This means your upper traps dominant and your mid and lower traps and rhomboids lag. Why it happens is because you shrug to stabilize overhead. To fix it, strengthen the scapular control, stretch upper traps, and reinforce proper shoulder positioning. For the posterior view, if the heel rises, it means the soleus is tight and your anterior tibialis is weak. You have limited ankle dorsiflexion. So to fix it, we're going to stretch calves, strengthen tibialis, and improve ankle mobility. Finally, you might have asymmetrical weight shift. It means one side compensates for weakness on the other. The glute medius imbalance is the most common. Your body favors strength and avoids weakness, so that's why this happens. To fix it, do single leg training, address side-to-side imbalances, and focus on control, not load. With every compensation, your body is solving a problem. Tight muscles pull you into bad positions. Weak muscles fail to stop it. Your job is to restore balance, rebuild control, and then load it. If you want better squats, stronger lifts, and fewer injuries, this is where it starts. Train smart, move clean, stay powerful.